Welcome to SmithWeekly Discussions, an occasional program for our members of SmithWeekly Research. Please note this program is a private discussion and everything contained herein is for entertainment and educational purposes only. With that, we are in a comfortable position, along with your favorite beverage, to enjoy the discussion. We remind our audience to examine our show notes attached to each of our shows to better understand how our program functions. Before we get into our discussion, we want to say thanks for questions coming from our audience at SmithWeekly, including Mark R., Ryan S., Paul M., and Todd A. We have a returning guest on the program today, and one we're pleased to have back with us. Dr. Brooke Miller has joined the podcast. Brooke is a board-certified medical doctor with about 39 years of clinical experience, specializing in emergency and family medicine at his private practice in Virginia, United States, which is called Miller Family Health and Wellness. Dr. Miller is also senior fellow at the Independent Medical Alliance. Brooke also has a commercial cattle business with his ranch in Virginia, Ginger Hill Angus. You can learn more about Brooke, his work, and practice by visiting gingerhillangus.com and also Miller Family Health and Wellness by email or phone. Dr. Miller, it's a pleasure to have you back on the program. Welcome.
Well, thank you for having me back, Andrew. It's been about a year since I think we last did one of these podcasts. Correct me if I'm wrong. And we have an annual family gathering of the children and grandchildren. We called it Cousins Camp. And I think we were in the middle of that last year when we recorded, and this year it's a week away. I also remember it was sort of funny that I had my computer hooked to my phone and I would get email or text message beeps, and that was sort of annoying, and hopefully that will not be a problem this time around.
Yeah, it's right at about 1 year anniversary within a couple of weeks. And It seemed like on the last time we talked, every time there was a beep that came in, it was just on a good point. So
I'm not sure about that. Just a couple of corrections. I always, you said nearly 39 years of clinical experience. I graduated from medical school in 1986. So that would be 39 years ago, because I know my 40-year anniversary reunion's coming up next year. But I sort of figure that I have 41 years of clinical experience because we started clinical medicine in medical school, after your second year in medical school. So that would be 2 more years there. So just a minor correction there. And a minor correction, we have a purebred seed stock business called Ginger Hill Angus. We also market some beef to people in our not so local area. So those are only two minor corrections, but you did a great job of introducing me otherwise. Thank you.
Well, you're splitting hairs now, but we're going to leave all the corrections right there. And the 2 years, 41 years. Appreciate that, man.
Yeah.
Good stuff. Well, it's good to have you back on, share some thoughts and give us some updates on a few things, plus give us a little bit of advice as well. The audience knows that we are mining, energy, and junior natural resource focused as investors, consultants, and researchers in those various segments that I mentioned there. But there is always a health and wellness side to this, as we often sit in chairs for much more time than we should. And so there is a connection. But yeah, it has been about a year since we did the last podcast. And I suppose from the surface that it appears that many things have changed. Not sure how much depth there is to that or what will stick on the wall. But from a health and wellness side, Brooke, what are some things that are on your mind, maybe some concerns, maybe some improvements that's impacting the folks out there?
Well, I think, Make America Healthy is definitely has good objectives. And, you are a different podcast as far as what your perspectives are, what you talk about. But in essence, nobody, I don't think there's a unhealthy person on the face of the planet that wouldn't trade monetary status to be extremely healthy and well. And I think that's probably one of the most important things in our lives and in our modern day world where everybody, inflation is through the roof and you have to have 2 jobs to raise a family and young kids can't afford a family. It's difficult to really for them to focus on health and wellness. But health and wellness is very simple. I tell my patients all the time that, most of what I see is self-inflicted. Most of the disease and chronic disease I see is self-inflicted. And health and wellness for most people, I know there are exceptions. For most people, it's pretty simple. It's a healthy diet, and you have to define what a healthy diet is. A good amount of sleep, 8 hours of sleep on average for most people, exercise, and sunlight. And those are the basics of health. And if you can master those, most likely you'll have a very happy and healthy life.
I'm sure folks should take a little bit of notes there. Obviously, this is coming from a licensed doctor that is in practice. And so maybe some of the issues that you're seeing so far, I know we're early days in terms of changes in regulatory, changes in departments, changes in administration, but talk a little bit about what you're seeing out there, maybe a few items that are on your mind as far as maybe concerns. Just talk a little bit more about that, then we'll move on.
Gosh, it's hard to pick one out. Um,
Yeah. Yeah.
Maha seems to be focusing on diet and removal of environmental toxins, whether it be pesticides. And that is all well and good, but there's a significant part of the medical freedom community that sees the pharmaceutical industry in general as being a huge problem and having too much power over our regulatory agencies and over the narrative of health and wellness. So that's one of the biggest things in my mind that needs to be corrected and get under control, is to have the health and regulatory agencies completely without conflict of interest. There's too much financial influence on the health and regulatory agencies from the industry that they regulate, and we need to get that out so we can actually rely on good, true, basic science and not paid for junk science.
Absolutely agreed with that. Seems to be that the jury's still out on some of that stuff there, but it's very, very clear now, and should be clear to everybody, that there is a huge amount of financial pressures behind all of this, and it filters entirely through the system. Whether you're talking about, a doctor that's studying in college now, a university, or even into high school programs, all the way down, it trickles down, and it's just this massive influence from really a handful of companies. It's really to promote their narrative and not necessarily health. And so that's where I think this is all at. And there's a lot of faucets of that we can open up, as far as the different areas that need fixing on that front. Maybe on the improvement side, maybe anything there that you're seeing that was a kind of a standout improvement, and be any issues you're seeing that are forthcoming that need to be.
The dietary guidelines are going to get redone to something that's more in line with true health and wellness. I think the dietary guidelines that were enacted in the 70s, the late 70s, is a major reason why we're in the shape that we're in right now as a nation, and also the world. America is fat and unhealthy, high rates of cancer. Life expectancy has been dropping. We have chronic disease going through the roof. We have children now that are type 2 diabetics, which was almost unheard of when I came through medical school in the early 80s. And I think all of this is a result of the dietary guidelines, and then the food corporations constructing food that is extremely unhealthy and addictive, but meet the dietary guidelines. And the dietary guidelines have such an influence throughout our society. The SNAP programs go on dietary guidelines. Food stamps go on dietary guidelines. The schools construct their menu based on the dietary guidelines. It's hard to believe, but even hospitals feed some of the worst food out there. They follow government constructed dietary guidelines.
Yeah, it's incredible. I'm not sure what area the government has ever given good advice, Brooke. I'm not sure. I would suspect people would come back and talk to their doctor, their family doctor, a friend, and someone that's been in the community, local community. It's just crazy. I mean,
Yeah,
if the
but
government
unfortunately, doctors are also,
bought,
they're not necessarily bought. I mean, some of them are. The ones that are pushing policy obviously are. But your everyday run of the mill doctor gives out really poor nutritional dietary advice. Just case in point, this week I had a gentleman come in, and I'm 64 and I'm in good shape. I try to eat right, I exercise, and I look probably from a physical standpoint quite a bit younger than my 64 years of age. And I had a guy, and most of my patients, not all of them, but most of my patients are obese, have hypertension, diabetes. Some of them have COPD, but they have cardiovascular disease and metabolic disorders from what they eat and lack of exercise. Well, this week I had a fellow come in, and I walk in. I'd never seen this guy before. I look at him. I said, "Wow, he's fit." And I was thinking probably 45, 50 years of age. And I said, "So how old are you?" And he said, "I'm 61." I said, "Oh my gosh." I said, "What are you doing here?" Basically. And he told me, he said, "Well, I've got tired of my doctor, my regular doctor, telling me things that I knew were wrong." And I said, "Well, what's he telling me?" And he said, "Well, I need to become a vegetarian and stop eating meat." And I said, "Oh, really?" I said, "What does he look like?" And he showed me a picture, and he's got this massively obese doctor with a 50-inch waist circumference, which is a huge risk factor for cardiovascular disease. And this guy actually believes what he is saying, and he has been brainwashed by the media, by the regulatory agencies, by the dietary guidelines, and he actually believes what he is doing is good, and he couldn't be himself any less metabolically unhealthy. It was just amazing to me. And we see this over and over and over again. Doctors who look extremely unhealthy giving out health advice. And there's just a big disconnect there. I don't understand it, but it's there. And I think they're just brainwashed.
Is the disconnect in the textbooks? Does it go down that far, Brooke? Or they just do a Google search to sort out what to provide for medical advice?
The disconnect is mass media. It's the brainwashing is the mass media. And the medical schools are also, I don't know what they're teaching in medical school now, but I mean, I know a couple of years ago, the dietary advice that they were giving out was just completely wrong, as is a lot of the science that they're teaching is based on things that are not sound science. I remember probably and I may have said this to your audience the last time we were on, but I remember my very first day of medical school, professor of anatomy got up and he made a statement that I'll remember for the rest of my life. Obviously, I've repeated it millions of times. He said, over half of everything that we teach you in medical school will later be proven wrong. And I did not believe him at the time. I thought, oh my God, no, I'm going to this great medical school. I'm learning the meaning of life and I'm going to learn everything. And there's no way they could be wrong. And now looking back on it, it was just so profound. And I let it guide my life and my thought process. And I'm constantly thinking and rethinking what is the truth and try not to get set in my mindset where I will not consider other things as possible truths or narratives. But the dietary guidelines were a big part of that, and what is healthy, and the thought process that animal fat is bad for you, and that we can construct something in the lab that is healthier than what God and nature constructs. Just totally false. And it comes from everywhere. It comes from medical schools. It comes from the American Heart Association, the American Diabetes Association, the pharmaceutical industry, big food industry. You go into the grocery store and you see this sign up and they're trying to make you believe that this food is healthy and they call it low fat. Well, I say if you see something that says low fat, you better run from it because it means it has highly processed, highly sugar. And it's just everywhere, just absolutely everywhere. And, it's like everybody knows cholesterol is bad for you because that's what you hear. But, what the science says is exactly the opposite.
Right. There's so many connections, and a pile of them are heavily financial in this. We've talked about it before. Subscription model. That is the crux of this. Keep people coming back for more. Horrible. This subscription model idea that is perpetrated everywhere, and it's basically never heal. Keep someone hooked and keep them paying, keep the cycle going. And the other piece is now is some of these Doctors, I suspect this is just a suspicion. I don't have anything to back this up, but what's AI say? What kind of medical advice is AI giving me? Is AI licensed? But let's just laugh and stop
You know,
there.
I do laugh about that because I use AI. I look to use up diagnosis codes and everything. Very rarely do I look for it for medical advice, but if I try to find a reference, it helps me find a reference. But I have arguments with AI all the time about things that I feel like I'm an expert on, and I usually can debate AI and get it to see my point of view. Now, whether that's teaching it anything, I don't know, but a lot of times I can make AI go back on what it tells me about certain subjects. And my wife laughs at me because I do it for fun. I just have a good time debating with AI.
And the other thing is there is to some extent only as good as the biases of the programmer or the parent company that owns it. To me, it's incredible to see people take this stuff for verification. They don't do any firsthand research, primary research. They just take it for what it is. And we have to remember all these competing AI systems are owned by somebody. It's the biases that go into them. Sure, are they convenient? Yes, but convenience, Brooke, another long winded conversation. We'll change the subject here in a minute, but convenience is a problem if it's not kept in check. We can talk about telephones. We can talk about AI writing our school papers. We can talk about all that stuff. And also things like this taking work away from people. So many things there, dumbing them down. All of those things go into this. And of course, you can add a few comments with this here. Topics on health and wellness, which we've started into a little bit here. But I wanted to start maybe coming back to, you mentioned cholesterol. That's one that's been brought back into question as to its role in the body and the necessity of it and its importance for good health. Talk about cholesterol. What are your thoughts there, as well as any other comments?
Well, cholesterol was put in our body by our creator for a reason. Cholesterol is used in to make every cell membrane in the body. It's used to make our hormones. It is without a doubt a very much needed part of our health and wellness in our body. It is definitely used by the brain. The brain is made up of mostly of fatty acids and lipids, cholesterol being a large, important part. I'll just say one statement real quick, a little bit of logic. The number one killer in the United States today is cardiovascular disease. The number one prescribed medicines for the last decade have been cholesterol reducing medications, specifically the statins. Now, would logic tell you that if cholesterol was the cause of heart disease and statins are the number one prescribed medicine in the United States, why is heart disease or cardiovascular disease still the number one killer in the United States? Now, cholesterol goes back to the cholesterol theory of cardiovascular disease goes back to a researcher named Ansel Keys in the 50s and 60s who did the 7 countries study. And he studied what populations of people ate and their incidence of heart disease. And he actually started out studying 23 different countries all across the globe. But when he put out his final report, it was only on 7 countries. And in those 7 countries, indeed, the correlation was in countries where there was a high level of saturated fat consumed by the population, there was higher heart disease. And in countries that he chose, consumed lower amounts of saturated fat, animal fat, there were lower incidence of heart disease. But what he negated to do was to include all the countries in his study, and it would have been just the opposite in twice as many countries as what he reported on. And he reported this to Congress, and Congress, then it became a political item. Another part of this story is he and a researcher named Ivan Lance did actually a randomized control study with men, I think men age 65 and above, where he fed them a high saturated animal fat diet, and he fed another group a plant based diet with high levels of linoleic acid. And indeed, in the plant based group, cholesterols were reduced. Total cholesterol was reduced. But when he compared the two groups as a whole, there was no difference in cardiovascular mortality. What they did see, and they never produced these findings until after Ivan Lance's death, and one of his family members found the data and was produced. What they did see was that for every, and this is men age 65 and above, for every 30 milligrams reduction in total cholesterol, there was an increase in all-cause mortality by 22%. So that study, and then there have been other studies that have backed this up that show that if you are put on cholesterol-lowering therapy, you don't live as long. Your all-cause mortality risk goes up. Let that sink in.
So do you think this was just, doesn't sound like it is, but do you think that was just a mistake in the study, that was just an honest mistake? Or do you think that someone saw everything and decided, well, this is the direction we should steer this one?
I think that was because he wanted the answer that he wanted. And when asked, there's been a lot of research that has shown lowering of cholesterol, especially in elderly people, is harmful. There have been a lot of studies that have backed that up, and a lot of them aren't published because they didn't expect the results, and they don't like the results, and they don't agree with the results. So investigator bias plays large in a lot of this. The other thing is that, funding. There are a lot of issues where funding determines the results of the study. And a lot of people are scared to go against what the narrative is because they're afraid that they're not going to get funded.
That's right. Well, that happens in every industry. It's huge. It's a huge impact, aside from just the normal biases. And then also, a lot of these folks that are in a career job or are funded, and that's where their paycheck comes from, they don't tend to open up on these things until later on in life, where they're disconnected from that, or their career is terminated, or they've, retired. And so it seems to be also that folks that are in that career period of their life tend to just stick with whatever the narrative being guided by the paycheck is. Whereas older folks who have gone out of that open up towards the end of their life as experience and wisdom sets in, and they decide to open up about these things. So we've also seen that as well. On the statins, Brooke, just talk a little bit more about that, because we wanted to get a little bit more thoughts there. And the statins goes beyond just the cholesterol portion. It goes into blood pressure and a few other things. Any other takes on the statins, and then we'll move on.
All in all, I personally would never take a statin. I think they have little to minimal benefit in treating people, what we call not primary prevention, but secondary prevention, where you have someone who has had an atherosclerotic event, be it a stroke or a heart attack, who is at high risk. I think there was a meta-analysis done 5 or 6 years ago with 350,000 patients where they could examine the raw data on statin studies, and there was basically no benefit in primary prevention. These are people who have no previous history of an event, and secondary prevention, people who have had an event, there's like 1% reduction in risk. And I think saw some statistician or something figured out that if you took a statin, you might live 3 days longer, based on secondary prevention, not primary prevention. I think they have definitive harmful side effects. In my mind and in my clinical experience, they're harmful for memory and the brain. And I think they're part of the reason. There are many reasons why we've seen an explosion in dementia in this country. I think they definitely can make you feel old and stiff and joints hurt, which will reduce your activity, which is obviously bad. I think it's well shown that they can adversely affect the liver. And I think one that is really scary, especially in the population that they're used, but statins cause muscle pain and stiffness and dysfunction by reducing CoQ10. It's thought CoQ10 in the bloodstream and in the tissues. Some people can reduce that side effect by taking supplemental CoQ10, others cannot. But guess what else is made from muscle? And that's our heart. And there have been some studies that link statins to a higher risk of heart failure. And if you put it already in a group of population of people that have heart disease, ischemic heart disease, who are at risk for heart failure, are we really helping these people? I have serious questions in my mind about that as well.
Not to mention the other things that help incite or help bring in myocarditis as well is another issue there.
Are we going to talk about that?
We better not, we might get banned. You add all these things together and you can really see how there's no way this is all just coincidence, that mistakes were made. I mean, these were knowingly made, but very good stuff here. So let's just say, for example, there's someone in the audience that is taking statins, for example. We'll just stay on that for a moment, then we'll move on. Just to give a tip here, right? We want to give some of the audience listening a tip here that helps out, and we'll get to a few more in a moment. Let's say, Brooke, for example, someone's taking a statin for blood pressure, cholesterol, what have you. How best would they come off, and would you expect, in some of your experience in dealing with folks that have come off these, I suspect there's some type of a shock to the system, maybe take some transition period, some call it tapering, what have you. I'm sure the body's not feeling immediately good as soon as you go off these, but just maybe talk a little bit about maybe an experience you've had or how you would tell someone to basically come off. I know it's not a direct patient, but anything you can say there.
Well, unfortunately, everybody that I see, and probably a lot of your listeners, are hearing mixed messages from the medical community. And right now, I think it's less and less doctors are really pushing statins, but it's still a significant number. I would say, well, in the circles I run now, hardly anybody believes in statins. And that's in the medical freedom world, Independent Medical Alliance, and the people that are aligned with that is actually looking at science and data. Most of the physicians in corporate medicine probably would tell their patients that they need to be on a statin if their cholesterol is above 200 or 220, or their LDL is above 120 or 100, or what are the risk factors that they have for cardiovascular disease. I truly don't believe that. I wouldn't recommend statins to anybody. And if someone is on a statin, I think the first thing they need to do is they need to reverse their cardiovascular risk factors as much as humanly possible. They can't change their genetics, but they sure can change their diet and their lifestyle. And that is number one. I would also recommend several supplements to most of my patients that I think are very, very low risk. Again, they should probably, if they have a trusted health advisor, they should speak with them directly. But I recommend a supplement, a natural supplement called Berberine, 500 milligrams by mouth twice daily. Berberine is plant derived, and it helps with a little bit with weight loss, although I haven't seen a great deal of weight loss in patients that have taken Berberine, independent of changing their diet. It helps with blood sugar metabolism and insulin sensitivity. But the biggest reason that I recommend it is some studies that I have seen and read where they compared patients with atherosclerotic cardiovascular disease, and they were able to visualize the atherosclerotic plaques through ultrasonography of the carotid arteries. And they studied these patients for 6 months, and they had one group that they used usual care, which was blood pressure medicine, statins, diabetes medicine, and then there was another group with usual care plus berberine. And the usual care group, during that 6-month time, the average atherosclerotic plaque increased by 1%. The group that took berberine, the atherosclerotic plaque regressed by 3.9%. And this is only over 6 months. That is a huge, huge change in the vascular status of your carotid arteries. And vascular disease is a systemic disorder, so it would be easy to draw to the conclusion that berberine is very healthy for your vasculature. The other natural supplement that I'm seeing some great data on is nattokinase. Nattokinase, we use it for various things, for vaccine injury and long COVID. But there was a study that I recently read on patients with atherosclerotic cardiovascular disease based on coronary angiography. And they gave Nattokinase in the form of 10,000 FU to these patients, and they saw significant reduction in atherosclerotic plaque in coronary arteries. So I think that's pretty landmark. It's very well tolerated. It's an antifibrinolytic natural supplement. It's readily available across the counter, as is Berberine, but it does carry a small increase in risk of bleeding. So if you're on a lot of anticoagulants, you might want to, be cognizant of that. But still, I have never had to take anybody, and I have a lot of patients on Nattokinase and Berberine now, and I have never had to take anybody off of either one of those due to a serious side effect. Occasionally, Nattokinase can cause diarrhea and upset stomach. I usually try to get the patients to just change a brand. It may be something that they use as an additive in the brand, but both of those are very well tolerated. So I would encourage all of our listeners to at least explore those two natural supplements and changing their personal habits, stopping smoking, start exercising, start eating an animal-based, high-protein, high-fat, clean diet without processed food, seed oils, etc. But getting off the statin, I have heard that they need to be stepped down. None of my patients that take my advice ever step down. They just stop them and they don't have any problems.
Good stuff for the notes to be taken there for the audience. Hopefully they took some notes. So it looks like, okay, so you have a potential to either taper them or just stop outright while implementing the other things you mentioned there at the same time would be my suspicion. That would be probably the best course there rather than even tapering them. But
we have not seen that as being a problem.
Well, hopefully the audience had something to take away on that, and there was a few folks listening in that might be considering this, so that's good. With that, you already start talking about a couple of supplements, but why don't we talk now about a few key medicines, supplements, et cetera, just maybe a couple there, Brooke. I know there's a lot, probably a longer list we could go through, but a few key medicines that folks really should keep stocked at home. This is of growing importance as the supply chains destabilize and suppression of certain remedies are also pushed. We could probably talk about all day on this subject, actually, but what are some you think are important to have in some of the uses?
I think vitamin D is the most critical vitamin on the planet. It actually acts as a hormone. It affects our bone and muscle strength and development. It affects how our muscles function. It affects our brain and it affects our immune system. So I think it is probably the single most important vitamin out there, although many of them are important. As a general rule, you should always try to get your vitamin D levels checked to see where you're at. Most people, what the labs list as normal ranges, I don't agree with. During the COVID pandemic, I think it was pretty rare. In speaking with intensive care specialists, they tell me that no one during the COVID pandemic was admitted to the intensive care unit that had a vitamin D level. In other words, all the vitamin D levels were low. And if you had vitamin D over 50, then there was virtually no one admitted to the intensive care unit with vitamin D levels above 50. I shoot for vitamin D levels above 50, 50 to 100, 110. It's very important to have it combined with K2, vitamin K2. I generally recommend for most people 5,000 IU of vitamin D3 and 100 milligrams of K2 in a combination. Some patients don't absorb vitamin D or dehydroxylate it. There are foods that can dehydroxylate it, high fructose corn syrup being one of those. So people with a highly processed diet will generally run low vitamin D levels. People that are obese generally have a poor diet and they'll run very low vitamin D levels. There are very few people that I see in my practice that I check that who are not taking vitamin D supplementation that have normal vitamin D levels. There are a couple people that completely eat completely clean, high animal based, organic type diet, no processed food, who are in the sunlight a lot, will on occasion have very good normal vitamin D levels. So vitamin D is extremely important. I like to recommend to most people take magnesium. Magnesium glycinate crosses the blood-brain barrier and it will help with sleep. Magnesium is a smooth muscle relaxer and helps with vasodilation. So that's another one that I recommend. I think vitamin C is a very important vitamin, especially in our immune system and warding off viral infections. Some people don't absorb it better. There are forms that are more expensive, that are encased in liposomes. So it's liposomal vitamin C. It bypasses or it travels through the gut, and the high acid environment doesn't inactivate it, and it seems to be absorbed better. Oh gosh, creatine. I've started taking creatine. It used to be a supplement. It's an amino acid, a supplement that was popularized by weightlifters and bodybuilders, and I always sort of shied away against it because of that. But then I've been reading a lot more and more studies on it. The most recent, really landmark study that came out about creatine showed that over 6 months' time, patients with mild to moderate Alzheimer's dementia were given 20 grams of creatine a day, and they saw at the end of 6 months significant improvement in memory and cognition with those that supplemented creatine 20 grams a day. Again, very low risk supplement. What do I do myself? I usually take between 5 and 10 grams. I'm not trying to reverse dementia because I don't think I have that, but I'm just trying to prevent it. And also I've noticed that it helps my muscles recover from exercise and my joints feel better. So those are some of the big supplements that I recommend for a lot of people. As far as prescription medications, I typically will not write prescription medications for people just to keep around if they're here in this community. If they go on a trip and are going to be away in a foreign country or third world country, I'll usually prescribe I'll let them have a Z-Pak, some ivermectin, possibly ciprofloxacin, depending on where they're going to travel. Those medications are very well tolerated as long as you don't have an allergy to them. Ivermectin is extremely well tolerated and extremely safe. It's across the counter in many countries. And there are many states, there are several states in the United States where it has become available across the counter as well. And so I think that's going to be easier and easier to get a hold of. And it has so many different positive modes of action. It has antiviral, antiparasitic, antibacterial, anti-neoplastic, anti-inflammatory, and it also is very good for promoting a healthy microbiome.
Once again, hopefully some folks took some notes because there was quite a bit there. With respect to sunlight, Brooke, we'll touch on that back to vitamin D. Irrespective, I mean, obviously a lot of folks are indoors working in some roles, but then there's more folks that are getting more vitamin D, which is obviously positive. Would you say that depending on maybe some of those lab results, you gave us that scale, I'm guessing that scale of 50 and 100 is a lab result scale, but for vitamin D from sunlight, folks should probably do some form of a supplement, period, because vitamin D has likely been stripped out often of not single ingredient foods, but probably in the food system it's been stripped out often. The numbers have been reduced as far as recommendations out there that you see. Would everybody want to do some form of supplementation, or do you think, getting outside, getting sunlight, and eating proper is enough?
Most people should have some form of supplementation. And that being said, if at all possible, get your levels checked so we're not guessing. If you can't get your levels checked, I don't know why in the world if someone couldn't get their levels checked. I try to tailor my therapy to vitamin D levels. So that would be my recommendation. Most people, a large majority, I would say 95% or more people, in my estimation, would need vitamin D supplementation.
Okay, that sounds good. So that's good for the audience there, and then of course, guessing most labs can do a basic vitamin D test.
Some labs have direct access, like LabCorp. They may have direct access where you can just go in and ask for a vitamin D level, and they'll give you a cash price, I think.
As you said with the ivermectin bit, lots of places are over the counter, lots of countries over the counter. It's good to see some states there in the U.S. finally get past this and get something moving with over the counter. But yeah, a lot of the labs, at least in my experience, and a lot of countries outside the US, you can order any lab test. You just pay the cash fee or present insurance, and you don't need a doctor's note to get a basic lab test. I mean, everybody has the right to go have their blood checked for whatever they want. That tends to happen a lot more outside the US, where it's much more restricted in the US, which you and I can get into as to why some of this is restricted coming from big pharma. But
Why else would they allow a pharmacist to give a vaccine and give medical advice if it wasn't coming from big pharma? And why would they not leave that in the hands of the doctors who treat patients? Um, it's you know, getting back to that, I mean, I write prescriptions all the time, and I get questioned severely by pharmacists, and it's like, it's really an insult. It really is. I mean, they really are giving out bad advice about medicines and drugs and vaccines, but it seems to be the wave. I mean, they have power over physicians because they can choose not to fill our prescription. Walmart is a huge violator of what I consider that to be.
That's completely backwards. That's obviously a regulatory issue that needs to be fixed immediately. That's completely ass backwards.
Yeah, yeah.
Hmm. So that's another one that's definitely in the continuing challenge areas as well. Well, why don't we move on here? Short of any other comments you want to add, Brooke, let's move to Ginger Hill Angus. Just give us an update there on how business is going, and then we'll get over to the practice.
As you may or may not know, we're a generational purebred seed stock Angus operation in Washington, Virginia. My grandfather and father started the herd around 1957 or 59. I wasn't around then, but I can't remember what the official date was. It's 57 or 59. So we've been around a long time. We sell breeding stock to commercial ranchers and producers and some purebred producers all over the country. We're a fairly sizable operation for Virginia, but would be considered small west of the Mississippi. We're enjoying basically the greatest market right now for live cattle in my lifetime. The reason for that is basically we have four major multinational packers that control protein in the world, and they have a monopoly, and they have made it so bad, made the market so non-competitive, non-free market for so long that we now have a shortage of cattle in the United States. We have lower cow herd numbers than any time since 1948. Our population is growing. Hopefully, beef consumption is growing as more and more people become educated on true nutrition and science. But basically, we can't produce enough beef in the United States. We have become a net importer of beef. And so the packers have no other option other than bid more competitively because of the cow herd numbers, because they have made it so people do not want to take over the family farm. People do not want to go into business. They see the hard work, the amount of capital that it takes to run an operation and start an operation, and the high risk of an operation and the very low reward. And so we are in a small window right now of opportunity where live cattle prices are as high as they have ever been in my lifetime. Now, obviously, with inflation and everything, we are having astronomical production costs too, so they're going up. But it's pretty good time to be in the cattle business right now. I will say that. Beef sales, we're having good beef sales. We sell grass raised, grain finished beef to, as far as custom beef to people in this area and as far north as Philadelphia and as far south as North Carolina. People they want to know where their beef is coming from. They want to know how it's raised and make sure it's raised in a healthy manner. And so it's good. I mean, things are good in the beef business. We're coming up on our annual bull sale in November, bull and cow sale, where we will sell breeding stock. We have an online presence there. We contract with DV Auction. You can look at the cattle on video and bid on video from the comfort of your home. We prefer people to come to the auction, but a lot of people, just like, it takes a lot of time and expense to go visit an operation. And with all the information available out there, we try to make as much pertinent information available as possible. We take a little bit different approach to our breeding program than the masses do. We try to breed an animal that will work on what God and we are able to provide it in a low cost environment, grass and hay basically, and not have to put a lot of inputs into the cattle in order to make them thrive and survive, because that would not be economically feasible for our customers who are commercial cow-calf producers who raise their cattle on grass and hay. We also are behind the eight ball as far as environment goes here in Virginia, as far west as Missouri, and a lot of the Southeast. We are, I say blessed facetiously, blessed with a grass called Kentucky 31 fescue. It's a very hardy grass. It grows and very drought resistant. It produces a large amount of grass, but the problem is it has a symbiotic relationship with an endophyte fungus and that secretes an ergot alkaloid that happens to be toxic to cattle and ruminants. It will cause miscarriages and abortions, reduce milk production, reduce reproductive health. It affects the hypothalamic pituitary axis adversely, and cattle cannot dissipate their heat, and they really suffer in the hot weather months. But we have developed over the years a strain of cattle that can deal with this endophyte toxic fungus as well as anything in the industry. So we're well positioned for people that are in our area to buy their seed stock from us, because our cattle are genetically adapted to this toxin about as well as can be expected.
Appreciate you going through that, and definitely encourage folks out there that are looking to buy one way or the other meat or for their own stock to take a look at this as well, and look at the information you have, and then obviously make contact as well. Any other comments just as far as, is there anything happening on the regulatory side that may start to reverse this to where we see the fleet of cattle, or the herd, as you say, start to increase? Is there anything on the table that's pending? Is there anything that could be positive here to where we start to see the reversal? It's going to take decades to get this changed, but anything you're seeing there, or is things still not getting any traction?
Well, unfortunately, Congress is very slow to act on anything. We desperately need, the American producer and rancher desperately needs country of origin labeling to be enacted in the law of the land, so people will know exactly where their beef is coming from. Currently, we have rules on the book, and it seems absurd, but a lot of things in life seem absurd nowadays, where beef can be imported from a foreign country and minimally transformed. They call it significant transformation, but it's minimally transformed, basically repackaged, and it can carry a product of the USA label. We have beef that's imported from countries with lesser standards than us that get a USDA grade inspection on there, and that's deceptive for as far as consumers. So we basically need Congress to enact true truth in labeling. I think the American consumer wants and deserves to know where their food comes from. Mandatory country of origin labeling would go a long way. We need to enact tariffs on foreign cattle that are raised under different lower standards, and they don't have minimum wages in these other countries. A lot of these other countries where we get cattle from, they deal with diseases that we don't have, and we try to keep out of our country. Right now, there's screwworm infestation in Mexico, the New World screwworm that's causing havoc in Mexico. And if it gets in this country, it'll cause havoc in the southern part of our country. And thankfully, USDA has closed the border from imports from Mexico because of this health risk and problem. But foot and mouth disease from Brazil is a problem, and we need to really take a hard look at that. They reportedly used child labor and forced labor in Brazil to raise cattle. They deforest the Amazon. There are a lot of issues why consumers deserve to know where their food is coming from and choose to support those that are doing it in a proper and moral manner, and just support the American rancher and the American farmer, because if things continue to go along as they are, and we don't restock or replenish our herds in this country, we will definitely be dependent on foreign countries and foreign monopolies and foreign corporations for our food. And I think we've seen supply chain issues with manufacturing and other things where we're dependent upon China or other countries for manufacturing or our medications or devices. It's not a good position to be in. It's not a smart position for this country to be a sovereign nation to be in. And so we certainly need Congress to enact laws. Unfortunately, they are influenced too heavily by the big corporations and their lobby and donations and things like that.
So that's absolutely right on. Yeah, we've got to get back to the basics here on these things, just as much as truth and labeling, as you said, but also, some of the lab grown stuff that's showing up there on the shelves is a huge troublesome issue.
Lab grown meat is a complete fallacy. They're talking about it being, quote, more environmentally friendly, and they have no data to nothing to support those claims. And what could be more efficient than sunshine and grass as growing beef? What is more efficient than using a natural resource that has no other legitimate use other than feeding to ruminant animals and produce healthy protein for the world?
Oh, it's fantastic, Brooke. Absolutely. No disagreement over here. Obviously, there's some folks out there that would rather replace the farm fields for the cattle with solar panels and wind turbines, but let's not get into that, and let's not get into the climate change piece of it either and how ridiculous that is. But you have to get back to these things. And then some of the labeling too, Brooke. I mean, just the organic rubber stamps that are out there, some of the influences on some of those houses. I mean, there's some legitimate ones that have legitimate third party testing, but then there's also some that are just paid third party testing. That's probably quite questionable. So there's a bit of a fad out there too on that piece where just because it has a USDA stamp on it, just look a little bit deeper. Don't always just take the advertising for truth. You have to look at it a little bit deeper and objectively. It's going to take decades to do this. There's got to be a transition off. You got to rebuild that fleet and grow it, rebuild that herd. And so lots of stuff here, and it's going to take some time, and you have to get action for sure.
I
Sure.
think you coined a new term, fleet. I'll have to call my cow herd my fleet, my cow fleet.
Well, as long as John Deere's not shutting down your tractors remotely, we're good to go, Brooke.
Yeah,
So good stuff there. I like the fleet one. The fleet one's kind of cool, but I like herd too. They're both good.
yeah.
Um, well, how about just real quick updates at the practice? Anything specifically there as far as how business is going, new clients, new patients, I should say. Anything there on the Miller family health and wellness side?
Well, business is booming. I'm thankful for that. We will be going through some transition in about a year. My son is in his last year of residency in family medicine at Bay Health in Delaware. He will be joining, plans are for him to join our practice. So we're going to have to do something as far as our physical location. We're going to either have to expand or find another place to move our practice to locally. We would not move out of the area. We will need to make some changes there. About that time, I have decided to switch my practice to all concierge medicine, which would be a fee to be in the practice, and then the patients would get, easier visits, longer visits, more personalized, patient-friendly service, much more availability. I envision my son coming in and taking over the regular patient practices, patients that do not seek those services. It's a risk, but that's what I want to do. I like spending time with my patients. I like sitting down and talking. I don't like seeing patients every 5, 10, 15 minutes. I like to get to know them and try to affect their health and their wellness by getting to know them and just talking with them longer. So that's what I've decided that I want to do. My wife will probably continue on in her regular practice. So we'll be expanding the practice most likely. We continue to provide both in-person visits and telehealth visits. We take a wellness approach. We obviously treat sickness and disease, but we try to get people off of medications through lifestyle changes and supplements, things like red and near infrared light therapy. And we continue to also have a little bit of a telehealth practice for people that live a ways away from us, and it's not always convenient for them to come be seen in person. So that's what's going on at the practice. Very, very busy, and we're looking forward to the addition of our son to join us.
That sounds good. Well, it sounds like things are going well and expanding a bit and catching a few other focus areas that need to get filled. So that's good stuff there, Brooke. Well, as we wrap up here, if there is someone listening in here, Brooke, and they want to engage services, whether it be as a potential patient at the practice or someone interested in the cattle business, just talk briefly about what services would be available. You already started to do that. And then also with that, I'll tie it in how interested parties can get in touch with your offices, phone, email, etc.
Sure. As far as the cattle business goes, they can contact me directly, Brooke at gingerhillangus.com, BROOKE at gingerhill, GINGERHILL, angus.com. Send me a message that way. We also have a Facebook page, Ginger Hill Angus. They can send a direct message there on the Facebook page. As far as the medical practice, name of the practice is Miller Family Health and Wellness. We have a Facebook page, and you can also email me, Brooke at millerfamilyhealthandwellness.com. The phone number, the office phone number is 540-987-5068. As far as the medical practice, we offer basically birth to grave care. We see little children, small children. We do office-based surgery. I have a particular interest in removing skin cancers, moles. We do cryotherapy for actinic keratoses and other skin lesions, but I have a long history of experience and feel like I do a great job doing some office surgery things in addition to the health and wellness aspect of the medical practice. The Angus business, the cattle business, we sell freezer beef, custom freezer beef. Users would, at this point in time, would have to pick it up, be able to pick it up here, not too far from the place. We haven't gotten it into a large enough scale where we ship, but I guess if we started getting orders where we need to start shipping, we could figure that out because it can be done. In order to ship, obviously, we'd need to work out the nuances of that, but there are a lot of people that ship beef across the country. Obviously, our biggest bread and butter and my passion in the cattle business is the seed stock industry, and we have an annual sale. It's usually the third Saturday in November. You can go to our website to try to look for updates on that, and our Facebook page, Ginger Hill Angus Facebook page, and our website, gingerhillangus.com. One other thing I wanted to point out is that I do have a Substack. I don't get to write as near as much as I would like, but you can follow me on Substack, Brooke Miller MD at substack.com. It's called the Rancher Doctor Newsletter. At Brooke Miller MD is my X handle.
Well, Brooke, good to chat. Thanks for that information. Lots of stuff there for the audience to look up, as well as some of your exposure there on various websites, Substack, Twitter, X as well. So good stuff. Well, look, it's been great to talk a few updates here, and we've already burned some good time. And also, thank you for giving a few tips to the audience. We hope our audience enjoyed the discussion, and we're looking forward to catching up again soon.
Absolutely, Andrew. Always good to talk to you, and glad you're doing well.